guys, I hope you guys are having a great day. I wanted to talk to you guys today about ER visits or emergency room visits and the kinds of doctors that you need to be seeing. I am going to say right up front, I am not an expert. I have only recently been diagnosed within the last few months, and I've had more diagnoses falling on my plate repeatedly, so I'm still learning things. I am not trying to tell you what to do, and this is not medical advice. However, I will tell you what my experience has been and what I have noticed from other people, because like I've said before, I'm in multiple groups on Facebook for POTS patients, as well as other chronic illnesses such as MS, EDS, all kinds of things, and I'm learning from those guys as well. But something I have noticed is how so many people go to the emergency room with their POTS symptoms. I would really like to know why that is. I'm not understanding it. And the reason I'm not understanding it could be because of the area of the country I'm from. I'm in Texas, Texarkana specifically. Our doctors know absolutely nothing about POTS. They know absolutely nothing about EDS. They've heard of multiple sclerosis, but they don't seem to know all the treatment options that are available. They basically just seem to take shots in the dark at things. And I get, like, when I first, before I became diagnosed and I started experiencing symptoms with my POTS and whatnot, I was having severe chest pain. I went to the emergency room a good 5 or 6 times within a week and a half maybe, because I thought I was having a heart attack. It hurt really bad. So now when I have those episodes and I'm having what feels like I'm having a heart attack and my heart rate is super duper high, unless my cardiologist out of Tyler told me unless it gets over 180, I had nothing to worry about. After that, that's when I should start worrying. So I try to keep that in mind, and I think to myself, this too shall pass. Just like the rest of you guys, I get dehydrated, but it's a $950 copay just for me to go to the emergency room. So I'm at this point, like, if I'm not dying, I'm not going. If I'm super dehydrated and feel super bad, I will drink a crap ton of Gatorade. I will drink a crap ton of water. I will just keep pumping it to me. And I realize that that is not what helps everyone. And I realize that sometimes it does not help me, and I could benefit from IV fluids to boost myself back up. But $950 for IV fluids is just ridiculous to me. Plus, they'll usually bill me on top of that for whatever my insurance didn't cover. Another thing our ER here is notorious for. If I go in, and I'd say, like right now, I can tell you every place I'm hurting right now. Every joint in my body, my ankles, knees, elbows, fingers, shoulders, all are hurting. My lower back hurts. I feel weak and tired. I know I probably should be drinking more right now, and I will as soon as I get done with my video, but I'm not going to go to the emergency room for that. My body is on fire. It feels like it is on fire. Before I knew what I had, before I had a diagnosis and read on it and researched it and learned about it from my doctor and from the internet and from other POTS patients that have been kind enough to share their experiences and walk me through this, I probably would have gone to the emergency room thinking, oh my God, I'm falling apart. But now that I know what is wrong, I don't go to the emergency room. I just tough it out, because our emergency room, their answer to everything is, here, let me give you a pain shot that is going to knock you out for the rest of the day and possibly into tomorrow, and then you'll just wake up in pain anyway. Because the pain shots that they give are opioids, and they really don't help me particularly. They just knock me out, and then I'm right back where I started, sometimes even worse because of rebound pain. So my question to you guys is, why? Is there something going on that you go to the emergency room for specifically? Are emergency rooms in other parts of the country better about treating POTS patients and know something that ours don't know here? What is it that prompts you to go? because I've just been suffering through it, just suffering. So if there's something different out there, please let me know, because I just really don't know. I'm confused. I don't understand why everybody runs to the emergency room when you know what's wrong with you. I get it if you think you might be having a heart attack, or if there's a new symptom that you haven't had before. But if it's the same stuff, why do we do that? If you guys have answers to that question, I would sure love to hear them, because I really, and I'm by no means judging anybody that does it, because I'm just wondering if there's something that your emergency room is doing for you that mine's not doing for me. Maybe I could ask. Maybe I could explore the options. I just don't know. So if you guys know more information, please share it with me. The other thing I wanted to talk about is the types of doctors. There's all kinds of doctors out there for all kinds of specialties. For me, I have been to an electrophysiologist and an endocrinologist and a regular cardiologist and a neurologist and, of course, a primary care doctor. My primary care doctor knows squat about POTS or anything else, and she's refusing to treat any of it. So she's like, I don't know about it, and I've given her resources for her to learn. She just refuses. So I went to the electrophysiologist first. He also did not know anything about POTS, EDS, none of it. So he just basically was like, okay, well, we did a singular EKG on you, and you're fine. We'll see you in a year. And I'm like, well, that was useless. But he did also send me to an endocrinologist who tested me for thyroid disease, which I did not have. My thyroid has been tested now in the last 6 months, probably 12 different times, and every single time it's totally fine. But he also tested me for some rare cancer that produces adrenaline in your body, which I also did not have. And then he was like, I can't help you. I don't know what's wrong with you. See you in a year. I'm like, well, why would I come back in a year? You don't know what's wrong with me. So then I decided I'd call my insurance company and be like, okay, who do you pay for out of town, out of my area? Because no one here knows what's going on. My insurance company was the best resource I had, and they were the ones that found me my cardiologist in Tyler. Yes, I drive 2.5 miles. I mean, not 2.5 miles, 2.5 hours. Sorry, guys. Yes, I drive. Well, I don't drive myself. My dad takes me because I can't drive that far. But it's worth it, because he tested everything he possibly could cardiology related. Found out I have coronary artery disease. And he said also I had some form of dysautonomia, but he did not know what it was, and that was not his area of expertise, but he had the perfect person to send me to. He made sure that my heart was in good shape and everything else, and ran every kind of test there was. He was the most thorough doctor, not to mention that his office was the most efficiently ran doctor's office I have ever seen in my life. I'm talking amazing. And then he sent me, he's like, I know this doctor personally. He's a neurologist. I think he'll be able to help you. I'm going to get you set up. And he did. And I got in fairly quickly. I would have liked to have been sooner, but you deal with the hand you're dealt. But anyway, so I went to a neurologist, Dr. Karen Puza, and also in Tyler. And he knew exactly, as soon as I went over all of my symptoms, and he looked over all of my medical records and all the tests that had been ran, and he looked at my tilt table test, and he was like, well, first of all, I know for a positive fact you have POTS. He said, which is a form of dysautonomia, which I already knew. I already knew these things because I'd done the research myself, because no one else knew what was going on. But then he went on with a barrage of other diagnoses. He diagnosed me with EDS. He also is testing me. I just had an MRI to test for multiple sclerosis. He thinks that my spinal column may be leaking spinal fluid, very slowly, but still leaking. He also said something about MALS, which is median acute ligament syndrome, due to some of the abdominal pain and swelling and nausea that I get on a daily basis. So he's going to check that out. And he's just started making a huge treatment plan to check for these things. And he explained everything to me, gave me resources to look at the information. Started setting up testing immediately. Like I've already started having tests ran. So if I had to choose doctors to go to, I've seen some people in the POTS groups and whatnot go to rheumatologist. And a rheumatologist is, they take care of like autoimmune diseases and things such as like arthritis and things of that nature. I'm not saying that they're a bad one to go to. I've been to a rheumatologist before I got sick with all of this because they thought that I had leukemia. But I did not have leukemia. I had a B12 deficiency, pernicious anemia, and had to start receiving injections for that. But otherwise, as soon as I did that, I was totally fine. Well, not totally, but a lot better anyway. But for me, the doctor that helped me the most is a cardiologist and a neurologist. So that's personally for me. Are there other doctors out there that can help chronically ill patients more than others? I am quite certain there are. However, I have very limited expertise in this. I have very limited experience in this. So I do know, however, there is a POTS treatment facility in Dallas. I do not know how well it does because I have not gone to it. It's something like $7,000 out of pocket because insurance does not cover it. At least not for me, it doesn't. So, and there are POTS treatment facilities all over the country, but they're so far apart that it's difficult for all POTS patients to really have access to that. I would suggest for you to Google those and see if you can find one near you that is affordable or that maybe your insurance would cover. Other than that, I really can't tell you who else as far as what type of doctor to see. However, I am completely open if you guys want to comment below and tell me what your experiences are, who you've seen, what type of doctors you've seen, where you have found the most benefit, so that we can get that out there to those people who are chronically ill and still seeking medical treatment, still trying to find a diagnosis and that peace of mind and that please help me, what can I do? They're still looking. So if you guys have any other options for them, please comment below. I'll be happy to do a second video, and I'll be happy to, include your names in there if you want me to, whatever you want. But I'd really like to help other people to be able to get into the right kind of doctor for them. So that's it for today. I'd really like to know about the emergency room, like what prompts you guys to go. What does your emergency room do differently than mine would? Because I don't go. It just costs too much money, and I know it's going to pass eventually. It may take several days, but it will. And then also, what types of doctors do you guys use? I would love to hear your experiences. So please comment below, like and subscribe to my channel, and I look forward to hearing from you guys. Have a great day.